Introducing new foods to your baby is a big milestone, filled with exciting first tastes and textures. It's a journey of discovery for both you and your little one. But it can also bring up worries about allergies, and it's natural to feel a little apprehensive. Food allergies happen when your baby's immune system mistakenly identifies a harmless food as a threat, like an invader, and reacts, triggering a response to defend against this perceived danger. This is different from a food intolerance, which doesn't involve the immune system. A food intolerance usually just causes digestive upset like bloating or discomfort. For example, a milk intolerance might cause gas or fussiness after feeding. But a milk allergy can cause hives, a skin rash, or even trouble breathing, which is a much more serious reaction. Knowing the difference helps you respond quickly and keep your baby safe, ensuring they get the care they need. You know your child best. Trust your instincts if something seems off after a new food. If you feel something isn't right, it's always best to err on the side of caution. Our goal isn't to make you afraid of food or to discourage you from introducing new flavors and textures, but to help you recognize warning signs so you can navigate this process with confidence. By learning what to look for and understanding the potential reactions, you can confidently let your baby explore new foods, expanding their palate and nutritional intake. Food should be a source of joy and discovery, not fear, for both you and your baby. Stay aware, not anxious. Knowledge is power, and preparation is key. If you notice changes in your baby's skin, like a new rash or increased redness, mood, or breathing after eating, pay attention. These could be important clues. This guide will help you spot the signs and know what to do next, providing you with the information you need. Take a deep breath. You're already doing a great job by being prepared and seeking information. Let's walk through the basics of food allergies together, step by step. You've got this. You're doing great, and you're not alone. When introducing new foods, especially common allergens like milk, eggs, or peanuts, watch your baby closely. Allergic reactions can show up within minutes or hours. Look for hives, rashes, or flushed skin. These are often the first signs. Digestive symptoms like vomiting or diarrhea can also signal an allergy. Swelling of the lips, tongue, or face is a serious warning sign. Breathing issues, wheezing, coughing, or trouble catching breath require immediate attention. Sudden sleepiness or limpness is also a red flag. If symptoms appear soon after eating, consider an allergy as the cause. Spotting these signs early helps you act fast. As a parent, understanding your baby's health is paramount. It's important to know the difference between mild and severe allergic reactions. Recognizing the nuances can ensure you respond appropriately and promptly. Mild reactions might include a few hives, which are often localized and not accompanied by other concerning symptoms. A small rash, perhaps just a patch of irritated skin, or mild stomach upset, perhaps some fussiness or a slight change in bowel habits. These symptoms are uncomfortable, but not dangerous in and of themselves. If your baby is alert and breathing normally, maintaining their usual level of activity, call your pediatrician for advice and avoid the food that you suspect caused the reaction. Severe reactions or anaphylaxis are a different story entirely. These involve more than one body system, indicating a widespread and potentially life-threatening response. This could manifest as hives plus trouble breathing, a clear sign of respiratory distress, or swelling, particularly around the face, lips, or tongue. Watch for wheezing, a high-pitched whistling sound during breathing, persistent cough that doesn't subside. Be alert for swelling of the lips or tongue, which can obstruct the airway, or sudden weakness, a noticeable decrease in muscle strength or responsiveness. If your baby seems pale, floppy, and unresponsive or loses consciousness even for a brief moment, it's an emergency and requires immediate medical attention. Repetitive vomiting with other symptoms, especially if accompanied by any of the other signs mentioned, can also signal a severe reaction that needs prompt intervention. If you see these signs, act immediately. Call for emergency medical assistance without delay. Don't wait. Every second counts in these situations. Ultimately, knowing when to worry and acting swiftly can save your baby's life. Quick recognition is key to ensuring the best possible outcome. Trust your instincts and seek help if you're unsure. It's always better to err on the side of caution when it comes to your baby's health. For mild symptoms, like a few hives, a slightly itchy rash, or minor stomach upset that doesn't seem to be worsening, it's usually best to call your pediatrician's office first. They can provide guidance and determine if an immediate visit is necessary. Describe exactly what your baby ate, including all ingredients and how much they consumed. Be as detailed as possible about the symptoms you saw when they started and how quickly they progressed. Your doctor will guide you on next steps, offering advice tailored to your baby's specific situation. They'll advise you on whether to avoid the food in the future and how strictly to avoid it. Never reintroduce a food that caused a reaction, even a mild one, without explicit medical advice from your pediatrician or an allergist. However, for severe symptoms, such as trouble breathing, significant swelling of the face, lips, or tongue, or any signs of limpness or unresponsiveness, or if you observe 2 or more body systems involved, like hives combined with vomiting, it indicates a serious reaction. Call 911 immediately for emergency medical assistance. Don't wait for your doctor to call you back or for the symptoms to worsen. Every second counts in a severe allergic reaction. If you have been prescribed an epinephrine auto-injector, such as an EpiPen, for your baby, use it immediately as directed by your doctor or the instructions on the device. Lay your baby down on their back, and if they are vomiting, carefully turn them onto their side to prevent choking. Don't give them anything to eat or drink, as this could worsen the situation or interfere with medical treatment. Stay calm, as difficult as it may be, and clearly and concisely tell the emergency responders exactly what's happening, what your baby ate, and any medications they've received. Your quick and decisive action in these critical moments can truly make all the difference in ensuring a positive outcome. When it comes to your baby's health and well-being, always err on the side of caution and seek medical attention when you have any concerns. Not all allergies show up as dramatic reactions. Some signs are subtle. Persistent eczema, especially after new foods, could signal an allergy. Chronic mild diarrhea or mucus in stools may point to a food issue, especially with milk or soy. Extreme fussiness or colicky behavior after eating can be a clue. Keep a food and symptom journal to spot patterns. Chronic runny nose or dark circles under the eyes may also be signs. Trust your gut. If something feels off, talk to your pediatrician. Early attention to subtle signs can prevent bigger problems later.